Welcome, everyone, back to the NAMI Maryland 40th Annual Conference. Those of you who are just joining us now, we've had an amazing yesterday and our annual meeting just now, and we've got an amazing rest of the day. So my name's Kate Farrenholt. I'm the Executive Director of NAMI Maryland, and we are so grateful that you've joined us today. This keynote presentation is special. We asked Rob Gargiola, who is partner at Compass Government Relations, to give a presentation. We have worked with Compass for the last 3 or 4, 5 years, I'm not sure. Some of you know Maura Cyphers. She has moved on, though she's still an avid NAMI member. But her team and Rob, who she has told me many times was her mentor, have transitioned to working with us on our policy and advocacy work. So we're so pleased to have Rob here, and he can tell you a little bit about himself, I'm sure. But before and also get into the meat of the presentation. But before we go into that, there's the usual housekeeping points. Again, we are pleased to offer closed captioning this year. I'm very excited. Captioning is only available for conference attendees who are using a desktop or a laptop. To enable captioning, please click on the little CC icon below the display of our presenters at the bottom of your screen. Once you click the icon, the video displays will become smaller and you will see the captions being generated underneath. If you have any comments, concerns, or technical issues, please post them in our chat to the right, and our technical assistant will address them accordingly. If there is time, we will be addressing questions at the end of the presentation. If you have any questions as the presentation continues, please post them in the Q&A column on the right-hand side of your screen. We will be reviewing questions as they come in, and if something in particular is unclear or needs to be expanded, we will ask our presenter after his presentation has concluded. We will also be sharing the questions with, thank you. We will also be sharing the questions with Rob and his team afterwards, and to the extent we feel it is important and necessary, we will be putting together an FAQ. So thank you very much. Rob, without further ado, I will go on mute, and you're on.
Well, thank you, Kate, and appreciate the opportunity to be here. I'm very excited to be participating this morning. Again, Rob Gargiola with Compass Government Relations Partners. As Kate mentioned, I've been involved in healthcare advocacy actually for close to 30 years. Worked on Capitol Hill for a member of Congress, focusing on healthcare issues, and then served as a senator in the Maryland State Senate and chaired a number of health-related committees, including a number of issues that NAMI had cared about over the years. And then retired in 2013 and got involved in state advocacy, and have been doing that now for nearly 10 years. We have a team of 8 lobbyists, but I would say there are 4 that are focused on NAMI issues. So half our team spends day-to-day advocating on your behalf, but at any given time, we may involve other members of the team as well. But while we're the boots on the ground, we're the lobbyists in the halls of Annapolis, you are really NAMI's biggest asset, truthfully. And you're its voice, and a powerful voice, and its heart. And truly, without all of you engaging, and hopefully for those who haven't, we can encourage you to engage in the future. 1, it's rewarding. 2, you can see the progress of things. And 3, it makes a difference. And so would encourage each of you who have engaged to continue to do so, because as I said, you're the powerful voice that makes things happen. So thank you for that. And for those that haven't, there are going to be many opportunities to engage, particularly with an election year and a lot of change that's going to be coming up. What I'm going to be focusing on really kind of 4 things. during this presentation. Number one, I want to touch on some of the successes from earlier this year in the 2022 session. I also, because it is an election year, want to touch on the primary and general election, which is coming up in a few weeks, and kind of highlight how there are great opportunities for NAMI because of the elections. And then finally, I want to touch on some of the things we're beginning to look at for the 2023 General Assembly session, which will be starting in early January with a brand new General Assembly, a new governor, new comptroller, new attorney general. So a lot of change. So with that, let's talk a little bit about some of our successes that are due in no small part to the advocacy of all of you and the work that Kate and her team have done during the last year. As many of you may recall, last session in 2022 was a bit of a hybrid session, meaning it was somewhat virtual, but then there were some aspects of it that were live. We're kind of on the back end of the COVID pandemic. We are anticipating it to be a more open session in person. There will be some virtual still, but we would expect it to be more kind of pre-pandemic oriented in the coming year. There were over 3,000 bills introduced this last session. And NAMI, and this is something that I would say as an organization, you have done with great success, had a hugely critically important NAMI Advocacy Day in Annapolis, talking to legislators, talking to staff. I believe we had nearly 180 of you participating in a training webinar. And I think we had over 100 of you participating in an advocacy day, which was done over Zoom this past year. We had 83 meetings with legislators and staff, and we had 3 major priorities that we focused on, which I'm going to touch on briefly now. First, there was legislation that was entitled Behavioral Health Crisis and Response Services. And because of the work of many of you and Kate and her team, this became law. And it basically prioritizes state grant funding to mobile crisis teams that minimize the role of law enforcement in crisis interaction and response. And it requires entities receiving 911 calls to develop written procedures to address calls involving an individual suffering an active mental health crisis, and efforts to bridge the gap between 911 and 988. This was a success. This was one of our priorities. You lobbied on it. You advocated for it. It was lobby day that was critically important, and it was many other communications with legislators and staff that made it happen. So thank you for helping to get that done. We also had a second priority during that lobby day, which was the 988 Trust Fund, which is kicked off earlier this year. Hugely important, implemented it in the state of Maryland and provided $10 million in initial funding. I'm going to talk a little bit more about this as we look towards the 2023 session, but that was a huge success. Again, thank you for being, kind of the boots on the ground as well to help get it done. The third priority, we were close. It's the Consumer Health Access Program, or CHAP, which is the acronym for it. And this bill would have delivered community-based and equity-focused assistance through one central entity, a hub, and 8 community-based organization services, the spokes. It would have been staffed by individuals with mental health lived experiences to help reduce the stigma and improve access to care. This legislation passed the Senate. We got funding in the Governor Hogan's budget, but in the final days of the session, unfortunately, it didn't get to the finish line in the House. We're going to be revisiting this bill, and I'll talk more about that in a moment. But the bottom line that I want to emphasize is 2022 was a success. Those are the 3 priorities we focused on. Batting, what is that? 666, that's a huge batting average and a huge success, and largely attributable to you. In addition, during the 22 session, we managed to get an 8% increase in Behavioral Health Administration funding, over $200 million of new funding. And there were 20 other bills that NAMI supported that passed and became law. So we had our priorities, but there were a lot of other issues that we focused on in the trenches day in, day out during the 90-day session. And again, thank you to many of you who were actively involved in helping to get that done. That was 2022, and very excited about the successes. We've got one bill from that session we're going to be focusing on next year. But I want to take a moment to talk a little bit about this being an election year, and a very important election year. There's going to be, I would say, probably the greatest change that we've seen really in a generation. Not only are we going to have a new governor for the first time in 8 years, we're going to have a new comptroller, we're going to have a new attorney general. Already, the primary in Maryland, the primary election was in July. And from the outcome of that and due to retirements, out of the 188 legislators in the Maryland General Assembly, we know that at least 40 are going to be new. And we still have the general election on November 8th. Early voting has begun with mail-in ballots, and on-site early voting will begin in the coming weeks. We do expect there to be some additional changes as a result of the general election. And then the other aspect of it is we're going to have a new governor. And typically with new governors, a number of legislators are likely to be appointed in the new administration. So even after the election, we're likely to see some changes in the General Assembly. And it wouldn't surprise me if, the numbers are 50 to 60 legislators are going to be new. That's nearly a third. We're going to have a younger legislature, which to me presents a lot of great opportunity. We've also seen somewhat as a result of the election, but additional changes that we've seen a couple years ago with a relatively new Senate president, relatively new speaker, essentially 3 years on the job for both. And then in the House, there are 6 standing committees. 4 of them have new committee chairs, including some of the committees that we really care about, like the Health and Government Operations Committee, Appropriations Committee, where the funding is. There are new committee chairs that are going to be holding the gavel this coming session for the first time. And in the Senate, 3 of the committees over the last couple of years have seen new committee chairs, including the Senate Finance Committee, which is where much of our healthcare legislation goes to, is going to have a new chair come January. We don't know yet who that person is going to be. I say all that to say that for those that have been engaged in this process, would encourage you to meet a lot of these new individuals, and we're going to talk more about that as well. And for those that haven't engaged in the process, well, let me tell you, you're going to be new to it, just like nearly 60 legislators and a new governor. And, these individuals all come from different backgrounds. They're approachable. You can meet with them in their districts. There's great opportunity with the change that's occurred, and I think it's very exciting and a very exciting time in the state of Maryland. I want to talk a little bit about 2023. I mentioned earlier the CHAP legislation, which passed the Senate and got some funding from Governor Hogan's budget, but didn't quite get to the finish line in the House of Delegates. There have been, in the interim, the 9 months that we're not in session, and continue to be, a number of work groups involving many of our champions, like Senator Augustine, who I think has presented some remarks or will be during this conference. He has been a strong champion for us on a number of issues, and he's committed to getting this legislation done in 2023. Our team has met with him as recently as a couple weeks ago, and we're working on kind of a strategy to figure out how do we move this legislation not only through the Senate again with some changes in the Senate, so there needs to be some re-education in the Senate with some of the new senators that are going to be coming in, including a new committee chair in the committee where this legislation will be presented, but also how do we get it to the finish line in the House, and how do we educate our next governor on these issues as well. So a lot of that planning is well underway, and that's going to continue to be a top priority for this organization, and we're going to need your help to help get it to the finish line. It's going to be critically important for your voice to be heard, and there are going to be many opportunities for you to speak about this legislation to help get it done. The other bill that I mentioned from 2022 that was a success and did get enacted and signed into law was what implemented the 988 in the state of Maryland. We did receive $10 million in funding, which is kind of covers us for the initial year for 988. And we're beginning to look at how do we fund this into the future? Can we find a dedicated fund for it? And so I would anticipate there being legislation in the 2023 session that deals with the funding aspect of this now that it's off the ground. And obviously, we need to continue to promote it and educate the public about it, but that's going to be something on the forefront as well. Another issue that we're going to be looking at is an expansion of school-based Medicaid funding for mental health issues. The federal government made changes to Medicaid about 7 years ago, almost 8 years ago now, that allowed states to get additional matching funds from the federal government to implement this. And I believe to date, there are about 14 states that have done this. Senator Augustine, a champion on many issues for us, is leading the effort in the Senate. And Delegate Laura Charkoudian, who I think we're going to hear from shortly, is looking to champion this in the House. A lot of work going into it right now, how we would set this up in the state of Maryland, but I would expect that to be something we're going to be focusing on in the 2023 session. And then finally, among many issues we're going to be focusing on in the coming year, we're going to be looking to go to the next governor and the legislature, because of new legislative powers on the budgeting front, to increase funding for the Behavioral Health Administration. There's a lot of federal dollars that have come to the state of Maryland. The state presently, which is unique and something that I haven't seen in 20 years easily, is experiencing significant budget surpluses this past year and into the coming year. And now really is the time to dedicate some of those funds to BHA. So those are a few of the issues that we're going to be focusing on because of the elections, and many legislative bills are yet to be thought through or begun to be pre-filed in an election year. There's a little bit of a lag in kind of the pre-session activity. So I would expect in the coming months, particularly as we get into November and December, there are going to be many other issues that are going to be coming up that the NAMI team, including many of you, are going to be looking at and deciding, do we put our weight, our political capital behind these other issues? So a lot of these are going to be surfacing in the coming weeks and months. We're very excited about the opportunities in the 2023 session. Look forward to advocating with many of you. And what I would say is, please look forward to our Advocacy Day during the General Assembly session. We're beginning to think about how we formulate that this coming year. I think we're looking at potentially continuing in some virtual fashion to allow more people to participate, but also an aspect of it where it might be live and in person. So stay tuned for that. But even before that, what I would say, and this is really what I'll close on before opening up for question and answer, is between now and January 11th, when they gavel in the new session and these new legislators come in, there's going to be a number of opportunities. And we're beginning to put those together for many affiliates throughout the state, as well as opportunities for many of you to begin engaging legislators now, to begin engaging legislators in the coming weeks and coming months, well before the January session. And also look for opportunities. We know there are going to be at least 40 new legislators coming to Annapolis as of now. There's likely to be a lot more once we get past the general election and see who the next governor appoints from the General Assembly. But there are at least 40 new legislators, and we're starting to put together a plan and opportunities for you to meet with these legislators in their districts. We don't know what committees they're going to be on, but it's a great time when they're just figuring out, like, I'm going to be a senator, I'm going to be a delegate, because they're in districts, although they have a general election, they're in districts that the Democrat will prevail or the Republican will prevail. They're going to get elected, and we're aware of that. And we're going to be setting up some of those meetings very, very soon and facilitating how you would set up some of those meetings where you can have coffee with a legislator, in their district, or perhaps get lunch or meet with them. And so those are going to be critically important opportunities, and opportunities to begin educating legislators about NAMI's mission, what NAMI does, and as important, telling your story. I think that really goes a long way to helping legislators understand what NAMI is about and what we're all trying to achieve and accomplish in the state of Maryland. So with that, I'll pause for questions and Kate, to see if you have other things that you wanted me to touch on as well. But again, excited to be here today and look forward to rolling up our sleeves and working with you in the coming months as we head towards 2023.
Well, thank you, Rob, and your team. And as you said, the boots on the ground are really essential, and I'm excited a little. As one of those boots, also besides being staff, I'm a little overwhelmed by the thought of all the opportunities to educate all these new people about what matters to us, especially in a time when everybody's paying attention to mental health.
That's right.
So, this is of all the times. It's exciting, a little overwhelming, and we're excited that and the Compass team will be helping with a lot of the materials as well as NAMI National. So we want to make sure that people have the opportunity, but to share that this matters to them, this matters to me. I have a sister, but then to have the materials so that the education is not all on you. Okay, so but I'm very excited about that. We actually don't have a lot of questions. In the comment section, there are a lot of hellos, and there's a comment here, several from Laura Mitchell. Thank you. Talking about the fact that we also got $40 million added to the autism waiver program to cut the 8-year waiting list in half, and the question is that included in the funding that we cited? And I don't believe it was. That was additional, I think.
Right. Yes, that's correct.
Yeah. Yeah. And so there's just a lot of opportunities here. The other
actually, on that point, if I may.
Yeah, please.
One of the things that's going to be very different this year compared to prior years, and the budget's going to be, is always a very important thing to this organization from a funding perspective. As Laura raised in the comments about the autism waiver, and I mentioned earlier about BHA. The General Assembly, for the first time, there's a constitutional amendment that was passed 2 years ago in the 2020 election. For the first time, they're going to be able to move funding around from one line item to another and put funding in priorities of the legislature. So up until today, or up until this coming session, the governor would present a budget, and the General Assembly only had the power to cut. And so what they would do is that they would identify a priority of the governor and say, we're going to cut your priority $100 million, because that's all they could do unless you put more money in something else. And that was kind of the leverage, or the only way that the General Assembly could try to leverage to encourage the governor to put money in a program. That's going to change this year for the first time ever in the state of Maryland. Prior governors in Maryland had immense budgetary authority. So this year, the new governor, I should say, will be presenting a new budget for the next fiscal year, which will begin July 1 of next year. But this time, the House and the Senate will have the opportunity to put more funding in programs. And so that does change the equation a little bit. We've been very active in working with Governor Hogan and previously O'Malley and other governors in the past in making sure we have good relationships with the executive branch. We'll continue to do that with the next governor. And we've already begun outreach to what's likely to be the next administration with Wes Moore. This is not a partisan thing, but that he's leading in the polls by 20 to 30 points. So we anticipate that to be the case. But we've made outreach, but it's going to be even more important to engage the legislature, because they will be able to put funding in. And I think that's a great opportunity for us and for NAMI Maryland to really, if it's on the autism funding or other funding priorities, 988, other types of things that we're looking at, there's going to be great opportunity in the 2023 session engaging the legislature for a lot of these funding initiatives.
Yeah, thank you. And Laura also put in the NAMI survey around the CHAP, around CHAP. Again, could you remind us, it's Consumer Health Access
Program.
Yes. Okay. Yep. Yes.
And I believe it's something that's currently being done successfully in New York. And And again, we had the support of some initial funding from Governor Hogan, and it passed the Senate. There are some in the insurance industry that I think raised concerns from their perspective, really in the 11th hour on the House side when the bill was over there. And it was enough to have members on the House side question, really in the 11th hour, should we do this now or should we try to get more information? And so that's the process that's underway these last few months and currently underway now with a work group that many are participating, including the NAMI team and members of Compass.
Yeah, and there are something like every state is a little bit different in how the CHAP process is being developed. But yes, there are a number of states, small number of states, but states that are doing that, and we're working with people who have also worked in those states. I will also note that the survey that we sent out, and this is just to show the power of the grassroots and lived experience and NAMI Maryland in Maryland. We sent out that survey, and we will. The link is there, but we'll send it. I think we're going to send it out again once or twice before, and we're going to stop on Wednesday because in the first couple of hours, we had something like 75 responses with people sharing their lived experience around specific questions, and we can use that. Even if the person doesn't want to be, testify or talk to reporters, or just they want to share it anonymously, we can use those
Absolutely
to really impact, and that is huge. Okay, yes, yeah. Danielle says over 100 responses in the first 12 hours. That's just
thank you.
Everybody's
Thank you.
That's great.
It is critically important.
So I do. Yes, it's always important, not only with the new people, but also people. I do know that one real quickly, and then we're going to go to a couple of videos, if you don't mind, to end this out. Just to share with you, there is a woman, Stacy Vota, who, for the very first time ever, publicly told her story. And she tells about, I didn't realize it really was the first time, she testified before the state legislature around the crisis bill. And one of the legislators who had been clearly against the legislation specifically said to her, your voice, your story changed my mind. I'm going to vote for this. And that, that's just, that's what you all do. So thank you.
Yeah, and don't underestimate the power of that. I mean, that really does move legislators. It really does, especially at the state level. I mean, it is state government is a lot more approachable than the federal government. There are great opportunities. I see one question, Kate, about meeting with legislators. We're going to be putting that together, and we're going to be doing it in a fashion where you'll be able to see which legislators, as well as new soon-to-be legislators, are from where you live, your district, your senator, your delegates, and providing you contact information, how you can reach out to them, as well as material about kind of what our priorities are, what we're focusing on. But again, it's really going to be your personal stories that are going to really resonate with them. It's not just reading from a list of these are our priorities. That's important because we want to advance the ball on a lot of issues we're doing in Annapolis. But it really is connecting with them, getting to know them, and truthfully, being a resource for them, not just this coming session, but in the years to come. So we're going to be putting those opportunities together very, very soon. So be on the lookout for that.
Okay, so we're going to do something a little different because we have one of our legislators shared a short video with us, and then what we're going to do is please continue to put questions in the comments, in the chat, in the Q&A, wherever you want to do it. We will be looking at them and sharing them and working on FAQs for you all. This is exciting. I wanted to, if Danielle could put in first Delegate Charkoudian's short video, and then we have the video from our national CEO, who I was with earlier this week, and he said to me, NAMI in Maryland, and that means all of you, is a real model. So he wanted to say something to you. So here we go. And we will be looking for, keep putting stuff in the chat. We'll be getting information to not only to those people who are on this, but also to a lot of people who couldn't be here. Danielle, how are you doing?
I am Delegate Lori Charkoudian. I represent. Greetings. I am Delegate Lori Charkoudian. I represent District 20 in the Maryland General Assembly. And I want to start by just saying thank you to NAMI, thank you to all of the staff and volunteers and advocates and members who work so hard to make sure that we are taking care of mental health for everybody in the state. In particular, I want to highlight what an honor and a privilege it's been to work with NAMI over the last 4 years. We've done a lot of work on mental health crisis response, and in particular, increasing funding for mobile crisis units, designing mobile crisis units to make sure that they are culturally competent and to make sure that they are designed in a way to minimize interactions between law enforcement and someone struggling with a mental health crisis. Now, as I prepare for the next year, I'm excited that I'll be working with NAMI on making sure that treatment plans really meet the needs of folks with severe mental health issues that lead to involuntary hospitalization, often in particular focusing on folks with not criminally responsible situations that leads to hospitalization. The other thing I'm really excited to be working with NAMI on is funding, Medicaid funding for mental health services in schools. And as we move this forward, it really has the potential to significantly increase mental health access for young people in schools. So looking forward to continuing to continuing to work together and grateful for all the work you do, and I hope the conference goes well.
So before we move to this video of Dan Gillison, I just wanted to remind people, please continue to put questions in the chat, the Q&A. We will be following up not only with the individuals who ask questions, but also to the extent that the questions are, and they all are, valuable, we will be providing these as FAQs for others. Okay, so thank you. And thank you very much, Rob, for doing this and for all the work that you and your team are doing to assist us and highlighting how important our field is.
Well, thank you. Appreciate the opportunity to be here again today.
Thank you.
Welcome, NAMI Maryland. I'm Dan Gillison, CEO of NAMI, the National Alliance on Mental Illness. It's great to see all of you, but most importantly, it's an honor, as it is every day of my life, to be able to work with you on our common cause in such amazing and uncommon ways. Whether it's raining or shining where you live, it's a good day. Good things are happening at a difficult time, unprecedented. Together, we are making inroads on the ongoing task of staying mentally well, despite it all. We're making strides, even leaps and bounds, towards better approaches and sounder answers. During the peak of the pandemic, it was often a day-to-day struggle in the trenches. Our optimism itself was even being assaulted. Now we're looking at the challenge of a lifetime with ramifications that will be felt into future lifetimes. What is my response? This is it. It's not your standard CEO smile. It's the smile of a man who has been part of the enormous heart of our NAMI community. A kid caught with his hand in the cookie jar of possibility, courtesy of every one of you. Today, we are celebrating the ingenuity and energy of our NAMI family with gratitude. Our NAMI community has never been energized by alarm, but rather inspired by need. The call to service that has no beginning and so far no end. This is what we have done since a small group of mothers gathered around a kitchen table in 1979 and founded our organization. They answered the call then, and we answer the call now. I am so proud of how our voice has grown to become the nation's leading and loudest beacon of hope in our field. When I look around us, I see a year of so much accomplishment. Wherever the call was heard, we have stepped out without hesitation to meet it. We have met our friends where they are, whether it is a place of hurt or distress, urgency or need. NAMI is there to diffuse the situation with service. You are answering the call. You haven't waited for problems to come to you. You meet them where they are and develop solutions. Young people in every community have struggled to cope with unrelenting stress, fear, anxiety, and loss. NAMI's new Youth and Young Adult Initiatives Task Force was created to focus on youth mental health and tackle the issue head on. The facts are heartbreaking, but no surprise to us. In February and March last year, emergency department visits for suspected suicide attempts were 51% higher among adolescent girls ages 12 to 17 compared to 2019. That's a 51% jump in 2 years. In June 2020, 75% of people 18 to 24 reported at least one mental health or substance use concern. We are answering the call with an emphasis on early intervention. More than half of high school students reported they experienced emotional abuse by a parent or other adult in the home, including swearing at, insulting, or putting them down. The CDC says that the pandemic has not affected teens equally, LGBTQ youth in particular. 75% suffered emotional abuse in the home and 20% reported physical abuse. These data echo a cry for help, the CDC says. We know we need to meet young people where they are, and we can only do that by hearing from them. How, you ask? With NAMI NextGen, a new young adult advisory group. Their call, our answer. NAMI NextGen is spearheading the update of NAMI Say It Out Loud, an informal initiative to get young adults talking more openly about mental health and wellness. When youth know that it's okay to not be okay and that there are people who care, they're more likely to ask for and get the help they deserve. That's why NAMI has created the online version of NAMI Ending the Silence for when in-person presentations are not available. NAMI is also reaching an even younger demographic this year. We want to help foster dialogue between young children and the safe adults in their lives. We want to provide children with a tool to express and explore their feelings in a fun, creative, and empowering way. NAMI released Meet Little Monster, a mental health coloring and activity book originally created by NAMI Washington. NAMI took this book that was developed in the field, added national resources, and made it publicly available countrywide in English and in Spanish. NAMI is thrilled to announce a multi-year partnership with the Girl Scouts to support mental well-being for girls in grades 4 through 12. Beginning in summer of 2023, workshops around the country will help girls better understand mental wellness and provide them with skills to strengthen their resilience and learn how to help friends and classmates. August marked the launch of Back to School for students, teachers, and parents everywhere. NAMI has new back-to-school guides and resources for parents and teachers this fall to help students and teachers navigate mental health in the classroom and beyond. We also have, in partnership with the JED Foundation, a new online mental health guide that addresses the specific needs of college students. In order to reach youth where they are, we are expanding our presence on TikTok and other social media platforms, and youth around the country are engaging. With a strong belief in help, not handcuffs, our new Justice Diversion Task Force helps strengthen our strategic goal. It keeps people with mental health conditions from entanglement in the justice system, starting with the way we handle mental health emergencies on the ground. We have reimagined crisis response with 68,000 advocacy actions that brought NAMI voices directly to policymakers. 988. There's a number you won't soon forget. 988, the new 3-digit number for mental health and suicide crisis, became available nationwide on July 16th, and communities across the country are answering the call literally. NAMI is leading the national call for the attention, vision, and funding to continue to make 988 and the full continuum of crisis care a life-changing reality in every part of the country. Answer the call. Our CEO Alliance for Mental Health, a collaborative of more than 15 of the nation's leading mental health professional organizations, advocacy groups, and funders, rolled out a coordinated effort to drive 988 preparedness and the nationwide transition from the previous National Suicide Prevention Lifeline. And the NAMI-led Reimagine Crisis Partnership sponsored a full-page ad in the Washington Post and advertising campaigns online and so much more to bring awareness to this number and our need to continue to advocate for resources. NAMI joins MTV Entertainment Group and the Biden-Harris administration in their new Mental Health Youth Action Forum. Mentors work in small groups to develop storytelling ideas focused on everyday mental health, the value of checking in with peers to offer support and services to seek out in a mental health crisis. We added a cross-cultural innovation and engagement task force as we seek to meet our underserved communities where they are, with the assurance that all NAMI programs are culturally responsive, equity-focused, and aligned with our growing understanding of trauma-informed care. NAMI Homefront Mental Health Resources launched on Veterans Day, offering free online resources that active duty service members, veterans, and their families can access anywhere, anytime. Answering the call also means changing the mental health conversation together. NAMI's nationwide impact grows through partnerships with corporations, media leaders, and influencers who actively share their mental health stories. Our Hearts and Minds program reminds everyone that mental health is physical health, with an emphasis on diabetes, diet, exercise, and smoking. Pathways to Hope. This past August, NAMI, FaithNet, and 17 state organizations and national affiliates across the country hosted the Pathways to Hope conference. Here, communities learned to build their own grassroots movement to help engage faith communities, mental health providers, NAMI members, and other community partners in building sustainable coalitions in support of people living with mental health conditions. It is a shining example of how NAMI is working to widen the impact of their answering and raising the volume of their call. Answer the call raised to the power of, well, let's just say a higher power. We don't just let our voices be heard, we make sure of it. It's one thing to meet people where they are. It's critical that we engage them, embrace them, empower them.
Socialization, finding an identity. These are the core.
Our share of voice is louder than ever. Over 70% of all major mental health media coverage. Our social media now boasts over 1 million followers with nearly 64 million annual impressions, a 38% increase over 2020. And we reach thousands of additional people at NAMICon, the largest grassroots gathering across the country and the world. I'm impressed, but I'm not amazed. There's nothing that together we cannot do for mental health here at NAMI. I mean, check this out. NAMI has partnered with no less a luminary than Ken Burns and the Wellbeings Project on PBS.
Hi, I'm Ken Burns. Our nation's youth are confronting a crisis, and they are asking us to listen and to help.
Ken Burns presents Hiding in Plain Sight, Youth Mental Illness, a major new public television documentary premiered in June across the country on PBS stations and streaming online. I was honored to represent the NAMI community at a screening at the White House with the filmmakers and First Lady, Dr. Jill Biden, as well as many of the youth featured in the film. The two-part, 4-hour documentary gives voice to the experiences of young people who struggle with mental health challenges and focuses on the importance of awareness and empathy. We encourage NAMI organizations across the country to host screenings and share this powerful documentary with your family, friends, and the larger community. Turn down the lights and encourage a brighter day. Yet another way to answer the call.
Crazy.
Lost it, can't keep it together.
Oprah and Prince Harry are in a new Apple TV Plus documentary series, which they produced, The Me You Can't See, welcoming NAMI Chief Medical Officer Dr. Ken Duckworth as the medical expert to weigh in on mental health stigma, treatment, and more. A moment now about our sensational NAMI helpline. A lot of ringing and pinging, and a lot of answering the calls. Such an inspirational outpouring energized our free nationwide resource and referral service as we added more hours and tripled its volunteer force to meet an unprecedented level of need. Dedicated employees and impassioned volunteers across the country draw on their lived mental health experience to provide resources and support. Our latest innovations in our response capabilities are live web chat, as well as the ability to text NAMI Helpline by texting Helpline to 62640. These new features immediately became effective ways for help seekers to reach us and are an important way for the NAMI Helpline volunteers to meet people, especially youth and young adults, where they are. Here's how you might find it. Sometimes young people confronting depression or anxiety find themselves alone. It's natural and painful. So maybe they'll reach to their digital device. Let me show you. And it's not just for young people. Hi, Siri. I'm feeling depressed.
I'm sorry to hear that. Talking to someone might help. If you'd like, I can help you call a friend or family member, or you can find help online at NAMI.org.
You can find help online at NAMI.org, and our volunteers are there to take the calls. We have amazing people answering the call at the NAMI helpline. One man at the helpline, Ron Homburg, 67 years young, worked for 30 plus years at NAMI in the areas of policy and advocacy. He's addressed Congress on behalf of people living with mental health conditions and families needing fair and affordable access to treatment and social support services. Then he retired. Well, no, he didn't. He committed himself to volunteering on the NAMI helpline. You and maybe Siri might find Ron if you call. He's busy helping a dad help a son entangled in the justice system. He can be found helping a person understand how to work through insurance issues to access care. He's on a call with a distraught mother explaining HIPAA laws and how best to work with her daughter's treatment team. He is all heart. And like all of you, he's the heart of NAMI. Ron and volunteers like him are confronting a growing crisis with a 60% rise in suicide rates for 10 to 24-year-olds. We answer the call, even when it's on a computer screen. Our caring, our sharing, shining ever more brightly. There's another example of extraordinary reach and resourcefulness that kind of says it all. A 9-year-old boy named Takari Tatum created a community service project for his class at school. He did this in honor of Simone Biles and Naomi Osaka, two of his favorite athletes who live with stress and anxiety, and also students experiencing mental health issues due to COVID. He was surrounded with heartbreak, and only some of it was personal. Takari's project was called SNAP. He decided to make stress bracelets, and anytime you feel stressed, you just snap it to remind yourself to stay calm.
I remember, snap it.
Maybe you are wondering how I can make a video like this and stay cool and collected, not even breaking into a sweat. It's not talent, it's Takari. In the time since beginning his project, his enthusiasm has gone viral. At last count, he passed out thousands of bracelets and raised thousands of dollars and provided tremendous awareness for NAMI walks. On January 24th of this year, Takari even went to the Georgia State Capitol and raised money and passed out bracelets to state representatives. And next, he plans to write his own children's book. Thanks, Takari. You're wise beyond your years. You know, it's quite an accomplishment that people like Takari can be so public about their involvement with mental health. Historically, there has been a stigma, as you know, around mental illness. I believe we are getting more open, more forthcoming about mental health. NAMI has never shied away from these issues, and we never will. We were founded, after all, as a response to serious mental illness, mothers confronting the needs of their children living with schizophrenia. Like the O'Brien family, their son Thomas, who was diagnosed with a serious mental illness at the age of 10, and his parents, Betsy and Dan, spent years trying to find a recovery plan that worked. After reaching a low point, they were connected to NAMI, and I mean really connected. They were heartened by meeting kindred spirits. They gained hope and results. Through NAMI classes, they learned how to advocate for Thomas's treatment. They got the skills to reach Thomas where he was. They also got to meet our very own Dr. Ken Duckworth at an annual NAMI convention, who led them to clozapine. And in Thomas's own words, this medicine was a game changer. He now has a job and a future. By meeting a family where they are in their mental health journey and inviting that family into the NAMI community, together with the O'Briens, we answered the call for Thomas. Every day, we turn a new page, begin a new chapter, and now we can actually say NAMI wrote the book on mental health. Did you hear that? You are not alone, the NAMI Guide to Navigating Mental Health. Thank you to our Chief Medical Officer, Dr. Ken Duckworth, who did the heavy lifting. Or as he says, the biggest thanks goes to the more than 120 people who have walked the arduous path of mental illness and shared with us what helped them and what they believe can help others. You're Not Alone is published by Zando Books, an exciting new publishing house founded by Molly Stern, the editor of Michelle Obama's runaway bestseller, Becoming. You're Not Alone is the go-to guide that we have been looking for years. As Ken says, it's the book he wished he had had when navigating his father's mental illness. When answering the call, even if you have the answers, you need to help people find them. Let's call it an education in navigation. Please share NAMI's new book widely with your friends, family, and your NAMI community. Together, let's make it the bestseller it's destined to be. It is available everywhere online and at your favorite bookstore. Have you heard? NAMI has started a new podcast called Hope Starts With Us. Listen or watch every other Wednesday on your favorite podcast app or on YouTube with your host, yours truly, Dan Gillison. We invite guests to share their stories of lived experience and bring important mental health topics to light. The new podcast focuses on one of NAMI's essential values, hope. Hope starts with us sharing our stories. Hope starts with us breaking the stigma. Hope starts with us sharing resources and practical advice. I can't wait to share many more conversations with all of you. Now let's talk about our amazing NAMI Walks community. I'm pleased to announce that through our remarkable support and execution on NAMI Walks Your Way, NAMI was recognized as Fundraising Organization of the Year by the Peer-to-Peer Professional Forum. This reflects our success in gathering 31% more funds than in 2020. If you haven't participated in NAMI Walks event yet, I urge you to lace them up and get after it this year. This is a special year for mental health in general, and NAMI Walks in particular. We have never been so empowered to answer so many pressing questions. and to call out to the newest solutions. As I like to say, when NAMI walks, people listen and the world changes.
So we're part of an amazing organization across the country, and Dan Gillison and his, increasing staff have really done an amazing job. But again, the grassroots is where the power is. I did want to mention that Ken Duckworth will be presenting as the finale today, along with several of the people from Maryland who were very actively participating in the development of this book as coming from their lived experience. I also wanted to mention that when Dan talked about Ken Burns, we worked with him directly on that series, and a lot of you all helped to get the word out. We did have a showing, but we also have 3 other. It's amazing right now. 3 other documentary filmmakers have been in touch with us around, and so we just on Monday did a private screening for a documentary filmmaker to get our input before he does his final edits. So lots of exciting stuff. And then the helpline, we have been approached by the national because of our extremely sophisticated warm line at NAMI Maryland, and they have invited us to try to meld the value added that they have, but also the additional resources and added value we have. So a lot of stuff really exciting that's happening, but just stick with us, please. The one thing, you are not alone, but you can feel alone until you actually have a conversation with someone else and their eyes light up and they go, oh, me too. That's connecting with other people and making it safe is really such a huge value added, but then educating the decision makers. Thank you, Rob. We will be getting a lot of information out to you. Don't worry.
Look forward to it.
Okay. Thanks again, everyone. And